and I'll be lecturing briefly on the treatment of colds and especially influenza with Chinese medicine. And we will be talking about Wenping. You've probably already heard about the meaning of Wenping. We will see in a moment what that means. But an understanding of the theory of Wenping and the 4 levels is essential to treat colds and flus. These are 3 famous doctors who occupied themselves with the theory of external wind invasions. Zhang Junjing is a famous doctor of the Han Dynasty. He's the author of the Shanghan Lun. The other 2 are much later, from the Qing Dynasty, and they developed the theory of Wenping diseases. As you can see, they were separated by about 13, 14 centuries, because the Shanghan Lun became the Bible in Chinese medicine for treating external diseases. But with the onset of epidemics in China in late Ming and Qing dynasty, a new theory of external diseases emerged. And especially with this doctor here, Ye Tianxue, is probably the most important one. Let's look briefly at influenza from the Western point of view first. It is a virus, as we all know. The influenza viruses are called A, B, or C. And one characteristic of the influenza virus is that they can mutate. And it's constantly mutating, so it's very difficult to create a vaccine for them. And some of these influenza epidemics killed millions of people. The famous one was, of course, the one in 1918, called the Spanish flu. Wrongly called so, because it actually had nothing to do with the Spaniards, but that name stuck. And it killed about 40-50 million people worldwide, more than did the First World War. 2 other epidemics more recently occurred in 1957 with 2 million people dead, and 1968 with 1 million dead. A few years ago, we had a mutation of the A virus into the avian flu. And more recently, the mutation of the A virus into the swine flu, which we are having at the moment. And the virus of the avian flu was H5N1. The one of the swine flu is H1N1 virus. Those are the symptoms of influenza. As we will see, they're all very meaningful in the Chinese interpretation. Fever, malaise, headache, body aches, dry cough, and sore throat. And as we will see from the Chinese point of view, the equivalent to the virus and bacteria is the concept of wind, as you're all very familiar with. Those are pictures of the new swine flu virus, the H1N1 virus. And there's an interesting quote on the website of the World Health Organization, which describes the swine flu virus. And it says that the upper respiratory infection causes complication when it becomes lower respiratory infections, which can lead to bronchitis and pneumonia. From the Chinese point of view, that is a classic representation of the transmission of the wind from the Wei level to the Qi level. And as we will see, it is crucial that we understand this transition from the Wei level to the Qi level. So let's look at the Chinese medicine view of viruses. And viruses in Chinese medicine are caused by invasion of the so-called exterior wind. We don't have to take that literally. It's not necessarily that you've been exposed to wind. And interestingly, the ancient character for wind contains within itself the ideogram for little insect, a bug. So it's almost as if it represents the bacteria or the virus carried in the air. And in order to treat these diseases in Chinese medicine, we cannot treat them without understanding the 6 stages from the Shanghan Lun, but especially the 4 levels of the Wenping disease. And in my opinion, for the treatment of influenza especially, the treatment, the theory of the 4 levels is much more useful, much more practical, and it corresponds more to clinical reality. These are the 2 doctors I've already mentioned. By the way, Wu Jutung, by the way, is the author of the famous Yin Chow pill, which is very popular also in the West, which is a great pill to take in the beginning stages of influenza, when it is still at the Wei level. So that is the comparison of the concept of wind in Chinese medicine with the Western concept of bacteria and virus. As you can see, for each disease in Western medicine is caused by a specific bacteria or virus. If you're invaded by one of these 3 viruses, A, B, C, you get influenza. You don't get polio from that. If you get invaded by Bordetella pertussis, you get pertussis or whooping cough. If you get the morbillium bacillum, you get measles, etc. So for each disease, there is a corresponding bacteria or virus. In Chinese medicine, it is different. We have this general concept of wind heat, which I repeat, we should not interpret literally as being due to atmospheric wind. And wind heat can cause any of those diseases, as you can see. And in fact, all those diseases in the beginning stages start with symptoms of invasions of wind heat. If a child falls ill and has a fever, a sore throat, swollen tonsils, we don't know whether he has influenza or he could have the beginning of whooping cough or measles or even polio. And that's another reason for paying great attention to diseases caused by wind heat. Some people might say, well, why do we need to treat them? It's just a sore throat and a fever. One reason we need to treat them is that because at that beginning stage, we don't know what it is going to develop into. And therefore, it's always important to treat them. These are the consequences of wind invasions, and these points here stress why we need to treat them. First of all, this is very common in the patients we see. After an invasion of wind heat, especially if it's a bacteria and the patient is given antibiotics, very often they appear to recover, but they don't. There is a residual pathogenic factor inside, which could be heat or phlegm heat. And this is extremely common in the patients we see. And I would go so far as saying that in children, this accounts for 50% of their problems. And also in children, a residual pathogenic factor can aggravate asthma, so it's important to treat for children who suffer from asthma. Number 3 is very important. A residual pathogenic factor often leads to chronic fatigue syndrome, which is very common in young adults. Number 4, in children who fall ill with the virus, they have a fever, a sore throat, we don't know what kind of disease they're getting. It could be measles, meningitis, polio, and that's why it's always important to treat them at the beginning stage. Even if we can't stop it at the beginning stage, we can still ameliorate the symptoms and prevent complications. Of course, the next reason for treating is that in some cases cause mortality. Even the normal flu, the normal influenza, quite apart from the swine flu, causes at least 26,000 deaths in the United States every year, just the normal flu. And the latent heat, which is often associated with this kind of diseases, is also a cause of more serious modern diseases and some autoimmune diseases. So these are 7 very, very good reasons for treating these diseases at the beginning stage. I am going to gloss over the 6 stages, not discuss them, because I want to concentrate on the 4 levels. Why do I do that? 2 reasons. One, according to my experience and understanding of the 4 levels, is much more clinically relevant in the treatment of these diseases. And 2, because there are many similarities. For example, the Wei level corresponds to the Taiyang level in the 6 stages. the qi level of the 4 levels is nearly the same as the bright yang stage. There is one particular pattern in the qi level of the 4 levels that is the same as the lesser yang, Xiao-yang pattern in the 6 stages. Therefore, we don't need to refer to both. And I will concentrate primarily on the 4 levels. Now, in the beginning stages of invasion of wind, these are the 3 cardinal symptoms from the Shanghai Lun: aversion to cold or shivering, occipital headache and stiff neck, and floating pulse. Aversion to cold means what? Means that the patient feels cold, the patient has that typical waves of shivering, and a characteristic of it is that this cold is not relieved by covering yourself. If you have a feeling of cold from yang deficiency, you cover yourself, you feel warmer. A characteristic of this aversion to cold is that you may go to bed under lots of blankets and you're still shivering. And that's typical. When that is present, it's typical of the beginning stages of an invasion of wind in Chinese medicine. And it should be stressed that the aversion to cold has nothing to do with the distinction between cold and wind heat. It's present in both cases. And it is due to the obstruction of the Wei Qi by wind. Because the Wei Qi warms the muscles, when it is obstructed by wind, it fails to warm the muscles and you feel cold. The occipital headache is due to the fact that this is the area of the Taiyang region, and not by chance the first stage in the 6 stages is Taiyang stage, which is the most exterior of the yang channels. So it's the first to be invaded. So there is occipital headache and cough. And the floating pulse reflect the rushing of Wei Qi towards the exterior, towards the surface, to fight the external wind. These are the 3 cardinal symptoms from the Shanghai Lun, and I stress very much the first one. As long as there is aversion to cold, the patient is at the Wei level, or Taiyang stage, the beginning stages of invasion. Besides this, there are many other symptoms such as sneezing, fever, cough, itchy throat, sore throat, body aches, which we're going to analyze in a moment. And one characteristic of the beginning stage of invasions of exterior wind is the simultaneous aversion to cold with fever. What we normally translate as fever, it is actually not fever in Chinese. It is called fa re. And fa re means emission of heat. So it's not, the patient may or may not have a fever. But what it means is that the patient is lying in bed shivering and feels cold, but you touch their forehead, the forehead feels hot, even if it may not have an actual temperature. So on the one hand, the aversion to cold is a subjective feeling of the patient, and the fa re, the emission of heat, is an objective hot feeling of the patient's forehead and dorsum of the hands. And the coexistence of these 2 symptoms, aversion to cold and fa re, is clearly symptomatic of the beginning stage, the first stage, when the wind is still on the exterior. This is the representation of the Zhou space. That's where the Wei Qi is, between the skin and muscles. Not literally between skin and muscles, but this is more an energetic level. And this is the level that is invaded by external wind. And that's why we, when we treat this level, we usually cause sweating, because the sweat also comes from this space. And by sweating, we also have the effect of expelling wind. So let's talk about Wenping now, which is a very, very interesting theory in Chinese medicine, and one that was entirely new compared to the theory of the Shanghai Lun. Why did it arise? It arose at the time in China where there were huge epidemics of diseases with fever and skin eruptions like smallpox, scarlet fever, and very much so measles. There are books written only on measles in Chinese medicine because it was a cause of huge mortality in China at that time. So these doctors began to doubt the theories of the Shanghai, according to which most external diseases were due to wind cold. And they clearly saw that all these diseases, all of them without any exception, manifest with symptoms of wind heat. And they also realized something very new for Chinese medicine, i.e. that these diseases are infectious. Until then, in Chinese medicine, the resistance to a bacteria or a virus was due to one's immune system. But these people realized that no matter how strong your immune system is, if there is an epidemic, most people will fall ill. And so this is a very important new departure in Chinese medicine, the concept of infection, which interestingly arose before the introduction of Western medicine into China. So these are the characteristics of Wenping diseases. They all manifest with wind heat, without any exception. Wind heat in a broad sense, it could also be other types of heat, but we will call them wind heat as a broad umbrella. There is always a fever. They are infectious. Interestingly, these ancient doctors understood that the wind heat penetrates via the nose and mouth. In the Shanghai Lun, Zhang Zhenjing says that the wind cold penetrates through the skin somehow. These people understood that it penetrates via the nose and mouth, and we know that bacteria and viruses do exactly that. They also understood that that pathogenic factor is particularly strong and virulent. No matter what you do, most people will get it. And it has a strong tendency to become interior very quickly, to go to the qi level. And finally, once inside, it has a strong tendency to dry up body fluids, to create dryness and yin deficiency very quickly. So, although all Wenping diseases are caused by wind heat, not all wind heat invasions are Wenping. I take two children. They both have a fever and a sore throat. One may have just a normal strep throat with an invasion of a virus. The other child may have the beginning of mononucleosis, which would be a Wenping type of disease. Or influenza itself is a Wenping type of disease. So all Wenping diseases have wind heat, but not all invasions of wind heat are Wenping diseases. And it's very important to understand this because the Wenping disease is more difficult to treat. So it's important for the prognosis. And another reason for understanding that is that if it is a Wenping disease, it goes to the qi level very quickly. So we have to be very ready, very quickly to treat at the qi level. So the Wenping diseases are more difficult to treat. Why do we treat them? For these reasons. Even though we may not stop it at the beginning stage, it's still worth treating them to alleviate the symptoms, shorten the course of the disease, most of all, especially in children, prevent the transmission to the yin and blood level, because as we will see, when the pathogenic factor goes to the yin or blood level, it is very serious, and that's when mortality occurs. There is a saying in Chinese medicine, in the Wenping school of disease, no one dies at the qi level. You can only die when the pathogenic factor reaches the yin or blood level. And that's why it's very important to have an understanding of how do we know when it has reached the yin or blood level. We can prevent complications. Let's say a patient with asthma has an influenza. we can treat it and prevent the asthma from getting worse. We can certainly do that. And prevent the formation of residual pathogenic factors. And these are the aims of treating a wimping disease, which we have just discussed. And by the way, most generally speaking, a treatment with acupuncture or Chinese herbs is not in contradiction with the Western treatment. There is nothing wrong with taking aspirin and yin chow pill, at the yin chow pill. There is no contradiction and no interaction. So these are the 4 levels: Wei level, Qi level, Yin, and blood. Let's see if we have a better diagram. Yes, that's a better diagram. So the 4 levels are these: Wei, Qi, Yin, and blood. The Wei level is the exterior level. At the Wei level, the wind is on the exterior, and that's the only exterior stage. The other 3 are all 3 interior. Interestingly, there is a difference of depth between Qi, Yin, and blood level. And the ancient Chinese doctor had an excellent understanding of that, which is very important because if the pathogenic factor reaches the Yin or blood level, it is potentially very serious. At the Wei level, there are 4 types of pathogenic factors. I will call them, I'll just include all of them under the general umbrella of wind heat, but it could be these as well: damp heat, dry heat, or summer heat. And the Wei level broadly corresponds to the Taiyang stage in the 6 stages. These are the symptoms at the Qi level, or the patterns of the Qi level. And the most common one that we see in the West is the first one. It's lung heat. And there is actually a variation of it, which should be here, which is lung phlegm heat. So most patients we see in the West, when the pathogenic factor penetrates to the Qi level, it will become either lung heat or lung phlegm heat. Other patterns do occur, and some of them more in children, especially this one, stomach and spleen damp heat. These are the symptoms of the Yin level. And notice a very important sign here. At the Yin level, what has happened? The external wind has become heat. By the way, in all the levels there is heat. The Wei level there is wind heat. In the Qi, Yin, and blood level there is internal heat. So here, what is happening here, the heat has become really very intense and is burning the yin at the yin with the G level. The heat is burning the yin, and the tongue is red without coating. That's probably the most fundamental difference, important sign between the Qi and the Yin level. At the Qi level, the tongue is red with a thick yellow dry coating, like that. At the Yin and blood level, the tongue is red without coating. And it's very easy to see, a very, very important symptom. You're treating a patient at the Qi level. He has a fever, a high fever. Let's say it's a child. If one day, suddenly, the tongue is red without coating, that's a bad sign. It's entering the Yin level. By the way, when we treat a patient with this type of diseases, we need to see them every day, even twice a day sometimes, because the clinical manifestations change very quickly. And this is the blood level, which is the last level. And that's one of the things that happen most frequently. The heat is entering the blood portion, and it causes bleeding. And as we will see, it causes also bleeding under the skin in the form of maculae or macules. And I think we'll see some pictures of it. And the second pattern is common in children. The heat can stir internal wind, and children get convulsions. So if you're treating a child with a high fever, one day he gets convulsion, by definition we know it's the blood level. So these are the most common patterns we see. Wind heat, dry heat, and damp heat, especially wind heat. And at the chi level, especially these two, lung heat or lung phlegm heat, the two most common ones. And these are the 4 stages. We can see them as concentric circles. That's the exterior, and that's how pathogenic factor penetrates from the wei, qi, yin, blood. And by definition, our aim in treatment must always be to stop it at the wei level. If you can't stop it at the wei level, stop it at the qi level. But generally speaking, the qi level is the crucial level. Most of the patients we see will go to the qi level, not the yin or blood level, which is a very serious situation. So that's really the battlefield in Wenping diseases, the qi level. That's when you eliminate the heat, resolve phlegm to clear the heat and eliminate the pathogenic factor. So this is repeating what I said earlier. It's worth repeating. A typical manifestation of the exterior stage, exterior level, or the wei level, is the simultaneous feeling of cold. The patient feels cold and is shivering because the wei qi is obstructing the space between skin and muscles. And I repeat, you have aversion to cold in wind heat as well. It's a total misconception that you don't have aversion to cold in wind heat. And simultaneously you have a temperature. And you touch especially the forehead and the dorsum of the hands. And the aversion to cold is a subjective feeling of the patient. You touch the patient and they have heat. So fara or fever is an objective sign. And typically the aversion to cold from an external wind is not relieved by covering yourself. You may go to bed with a thick duvet or comforter and you're still shivering. It's a very typical sign. And this diagram illustrates that principle. So we can say that the intensity of the aversion to cold reflects what? The intensity of the pathogenic factor. The stronger the pathogenic factor, the stronger the wind, the more you have this aversion to cold. I repeat, even when it's wind heat. The fever, on the other hand, reflects the strength of your immune system, of zheng qi. The more you react, the higher is the fever. So from the Chinese point of view, a high fever would indicate that the zheng qi is reacting to the invasion of wind. And in fact, we can plot 3 different situations. This is the strength of the wind, this is the strength of the wei qi, and that's the fever. If they're both strong, you have a high fever. If they're both weak, you have a low fever. Or if one is strong and the other is weak, i.e. the pathogenic factor is strong and your wei qi is weak, which is a very common situation, or vice versa, you have medium fever. Of course, the reaction of a person to cold, to bacteria and viruses depends also on the constitution of the person. So why do we get wind heat? I mean, you can get wind heat in very cold countries. How do you get wind heat in Finland or Norway, in very cold countries? You do all the time. It's partly also because of the constitution of a person. If you have a young constitution with tendency to heat, and you're invaded by wind, you'll get wind heat. If you have a deficiency of young constitution, you're invaded by wind, you may get wind cold. So that's another factor. Plus, there are also external artificial factors which may determine whether you get wind heat or wind cold. Some people were exposed to heat through their profession. if they get an invasion of wind, it may be wind heat rather than wind cold. And this table here illustrates the differences between cold and wind heat, and I believe you have this in your notes. I just wanted to stress again that the aversion to cold is present in both, and it's due to the wind obstructing the wei qi, and because the wei qi warms the body, you feel cold. So in invasions of wind cold, you use the remedy called expel wind cold, which is a variation of Jing Feng Jie Biao Tang. For invasions of wind heat, you use expel wind heat, which is a variation of the famous Yin Chao San. And I always recommend to any family with children or small children to have a huge stock of Yin Chao San or expel wind heat, because children are getting invasions of wind heat all the time. And that's how an invasion of wind heat might manifest on the tongue, and especially in children. Children very often will get these red points very quickly in these areas, which reflect the exterior of the body. And in children, in fact, these red points appear even before the symptoms. If your child, say you have a 3-year-old child, one morning he wakes up and is in a bad mood, nothing is right. If you look at the tongue, if he has these red points, he's probably coming down with something. He has an invasion of wind heat. These are examples of redness in those areas. That's on the sides, as you can see, towards the front. That's in the front third of the tongue. That's both, with red points. And these are examples of red points in the same areas. Although these tongues do not necessarily reflect or relate to patients with influenza, they do indicate the areas to look at. And that's probably the best example of it, of how an invasion of wind heat might manifest in a child in those areas. So you have a patient with influenza. The most important thing to establish, the first thing to establish, is it wei level or qi level? Is it external level or not? It's the most important thing, because the treatment is very different in the two cases. And the distinction is very simple. If the patient has this famous aversion to cold that we discussed, feels cold and shivery, it is external stage. It's still the wei level. So we need to expel wind. If the patient feels hot, it throws the blankets off, it's the qi level. And you see this in children very clearly. And within a matter of hours, it can change. The child goes to bed and is shivering and is under the blankets. And suddenly you go and check on him and he's taking the blankets off and he's hot. That's a clear sign that it's changed from the wei level to the qi level, and the pathogenic factor has become interior, and the treatment is completely different. Because at the wei level, the treatment is to expel wind. At the qi level, the treatment is to clear heat. So that's the first thing to establish whether it's wei or qi level. If it is interior heat, qi level, we must make sure it is qi level and not yin or blood level. And fortunately, the distinction is very easy according to the tongue. If the tongue has a thick yellow coating, or brown or yellow, even black sometimes, it is qi level. If the tongue is red without coating, it is yin level. In the patient, the most people will probably be at the qi level. And the two most common patterns we see will be lung heat or lung phlegm heat. And as we will see, I've got two remedies for these two patterns. We've already discussed this. And these are another interesting distinction between Qi level and Yin level. At the Qi level, you have papules. And papules are skin eruptions which stick out. If you run your finger over them, they stick out. You can feel them like little bumps on the skin. These are typical papules in a child, probably with a viral infection. As long as you have a papule, you're at the Qi level, and it's not serious. I repeat, the papule sticks out. It's like a little bump on the skin, which you can feel. It indicates interior heat at the Qi level. So the three treasure remedies for the Qi level are two. Ringing metal is a variation of Qin Qi Hua Tang Tang, which means clearing Qi and resolving phlegm, and that explains what the remedy does. And this is the remedy for phlegm heat. So the patient has a cough, is a productive cough with a lot of phlegm, yellow phlegm, the tongue has a sticky yellow coating, a fever. So the patient has a chest infection. It's the Qi level of an invasional wind. And that is the remedy, and the dosage that you use for an acute disease like that is fairly high dosage. I would say the very minimum of 9 tablets, but up to 12 or 15. For an adults, of course, the dosages I'm giving you are dosage for adults, which should be reduced accordingly in children. And those are the ingredients of ringing metal, which I believe you will have in your notes. Clear metal is also for the Qi level, so they are both Qi level. And clear metal is more for lung heat, not so much lung phlegm heat. But the other difference between clear metal and ringing metal is that this is also for the beginning of the Yin level. So you can use it also if it's going to the Yin level. And it has a strong antiviral effect. It's got many herbs which have an antiviral effect, such, especially this one, Ta Ching Ye, Ban Lang Gen, and this one, Mao Dong Qing. The dosage is the same, the very minimum 9 tablets, but I would say for an adult 12 or 15. And as I said, you can use clear metal for the Yin level. And I said the Yin level and blood level are the very serious stage, and I would not advise you to treat it, especially the blood level. And one characteristic of the blood level is macules. So if you see any child with a high fever with macules, has to be rushed to hospital. Because it is life-threatening. And macules, how do they differ from papules? If you remember, these were papules, little red spots that stick out. Macules don't stick out. They are under the skin. They are red. If you run your finger over them, there's nothing to feel. You don't feel them. And they are much more serious sign than papules because they indicate heat at the blood level. It's the deepest level. And that's a very good example of it. These are very serious because they're very big and his whole body is covered with them. It's an extremely serious case of macules, and that's a very bad sign. When the macule is that dark, it means it's really deep, really very serious stage. So we do not treat Yin and blood level, except the Yin level is not always a very severe stage. Children can often go from the Qi level, children can often kind of dip into the Yin level for like half a day or a few hours, and you can see it from the tongue losing the coating. And that's when you can use clear metal for that stage. But definitely, if you see macules, it is definitely a very bad sign, very serious sign. and we should not treat them. These are examples of tongues at the 4 levels, and as you can see, the distinction is very easy, very easy. At the way level, it's very mildly red. Children might have red points, and there is a relatively thin coating. It doesn't matter whether it's white or yellow. It could be white, it could be yellow. At the chi level, the tongue is redder, like that. There is a thicker coating. But there's something we didn't discuss. At the chi level, you have 2 situations. One is called heat, and one is called fire. They are basically the same. But fire is more intense than heat, and it's kind of deeper than heat. But they are both chi level. And these 2 tongues illustrate it very clearly. When the heat becomes fire, the tongue has a very thick, very dark coating. Dark yellow, brown, even black, like this case. But I stress they are both chi level. At the yin level, the tongue has no coating. So you can see this in the context of fevers. This tongue can change to that in a day or 2 days in the context of fevers. And at the blood level, the tongue is deep red without coating with big spots, which could be red or purple. But the tongue at the yin and blood level is similar, without coating. These are the symptoms, the complications of the swine flu from the WHO website, and with an interpretation from the Chinese point of view. As long as it's an upper respiratory tract symptoms, is the exterior stage, the way level. If the fever is very high, with lower respiratory tract symptoms, is chi level in the lungs, etc., etc. And you'll have these in your notes. Occasionally there is digestive symptoms like diarrhea, abdominal pain. That would be the other pattern, which we haven't discussed. The other chi level pattern, with heat in stomach and intestines. Dyspnea, respiratory distress, tachypnea, respiratory crackles, also chi level with lung heat. Sputum indicates phlegm heat as opposed to lung heat. Bleeding from the nose and gums is a bad sign. Whenever you have bleeding during an acute fever, it indicates you've reached the blood level. That's another sign of blood level. 1 was the tongue red without coating. 2, macules. 3, bleeding. In the context, in the course of an acute febrile disease. In fact, it can be pulmonary hemorrhage. That would be very serious lung heat at the blood level. And we already discussed the 3 threshold remedies with ring and repair. Ringing metal is for phlegm heat. Clear metal is for lung heat. And lastly, this is the remedy for prevention to take. I stress this is not to treat the influenza. It's not. It's to be taken for prevention. You can take it for a long time, for months on end. And in fact, you should take it for months on end. And it tonifies lungs and kidney qi. Because I believe that our immune system, the strength of our immune system, depends not only on the lungs and wei qi, but also on the strength of the kidneys. And when you take a remedy for prevention like that for a long time, you usually take it with a low dose. For an adult, I would say only 4 tablets a day. I have 2 herbal sentinel remedies, 1 yang and 1 yin. And the herbal sentinel yang is for people with the tendency to yang deficiency. And the herbal sentinel yin is for people with the tendency to yin deficiency, i.e. the tongue may be lacking in coating completely or partially. And by the way, from the acupuncture point of view, a very good way to tonify lungs and kidneys is with the back shu points. Bladder 13, Du 12, and bladder 23, Shen Shu. And for the acute stage, wind heat, expel wind heat. So for the acute stage, expel wind heat, way level. For the way level, ring in metal for phlegm heat, clear matter for heat. And for prevention, herbal sentinel, yin or yang. And I think this brings the presentation to an end. So I hope it has been useful for you. Thank you.